The Rio Grande Valley, located at the southernmost tip of Texas. The valley is 4 hours south of San Antonio and situated along the northern bank of the Rio Grande River. Border towns and beach communities outline the rural, urban, and everything in between. Composed of diverse communities woven together by a thread of vibrant culture, the valley is full of tight-knit families with rich traditions. The valley is undoubtedly one of the most unique areas in the state of Texas. And while that distinction lends to the charm of the region, it also presents a unique set of challenges for healthcare in its communities.
So the predominant healthcare issues in the valley are really two. One is accessibility to care. 70%, if not more, of our people do not have healthcare insurance. So that makes going to the doctor, whether it be for something acute or chronic, a hardship. The second problem is diabetes. 1 in 3 of our people are diabetic, and 50% of them don't know it as they walk around every day in their cities and homes. So that makes us the most diabetic population in the nation, with probably the least access to medical care.
Rio Grande Valley counties have some of the highest incidences of obesity and diabetes in South Texas. To make matters worse, communities in the valley are among the poorest in the state and include some of the highest concentrations of the uninsured. So where do you begin? Methodist Healthcare Ministries has been in the valley for over a decade, providing direct services in places where it's needed most. Through our Wesley Nurse and Community Counseling programs, we are able to provide vital health education and counseling services to the uninsured. Our Wesley Nurse team also conducts a thorough survey of each community they serve to identify assets and create connections within communities. Through these programs and the relationships they've formed in the community, we have been able to gain a better understanding of the needs in the Rio Grande Valley, which has helped guide our funding and community engagement efforts to make a greater positive impact on health outcomes in the region. Since 2002, we have invested nearly $18.8 million to support organizations dedicated to improving health outcomes in the Rio Grande Valley. One of the issues identified in the valley is lack of access to healthcare services due to a shortage of providers. Through funding and collaboration, we were able to help partners provide integrated behavioral health solutions.
Through the collaboration with Methodist Healthcare Ministries, we were able to gain the support we needed to introduce the integrated behavioral health program here at the Rio Grande State Center. And aside from the financial support of the grant funding, we were able to work with the community counseling services in putting a counselor here in the clinic that works side by side with our physicians.
What that does is that allows us to do a warm handoff and bring them in to assist. So we let the patient know we have help for you. And now it's easier to be able to ask the question, how are you doing? And if we find out that they are not well, that is interfering with how they're doing with their medications, how they're doing at home, whether they're following a diet or not. We've been very happy to see that some of them have made like tremendous just conversions in their lives. And so it helps the physician, it helps the patient, and definitely the counselors are the best thing to put into an actual primary care. We love to be integrated, and that has really been a benefit for everyone.
We have been strategic with our endeavors to improve healthcare in the valley and have recently built new alliances through our community engagement initiative, Unidos contra la Diabetes. This initiative brings together a diverse coalition of local stakeholders to better align their efforts to reduce incidences of type 2 diabetes.
The great thing about South Texas and the Valley, Cameron and Hidalgo and Willacy counties in particular, is that there are an amazing number of dedicated organizations doing great work and working hard at it. What Unidos has allowed us to do is bring together those organizations and more, it's growing, right, to think about how can we work together? How can we align our initiatives so that we're moving forward in the same direction? And not that we necessarily were competing before. We were just working separately and working really hard. But now we're together, we're talking about the approach we want to take, the work we want to do. We've identified the common agenda, which sets forth all of our goals and where we're going, and that's the prevention of diabetes. So taking time to do that, set that a common agenda, and get to know one another in a different and deeper way is very different for South Texas and for our counties in particular.
We also work to attract and leverage local and national funds to invest in programs seeking solutions through integrated behavioral health models that focus on the comorbidity of mental health and chronic diseases such as diabetes and obesity. We are discovering new ways to address health issues in the Valley, and through strategic partnerships and thorough evaluation, we can identify innovative and effective solutions. With this new research and data, we will continue to be an advocate for the least served in South Texas and promote policies at the Capitol that benefit all Texans. The Rio Grande Valley is beautiful, and its people are strong. With new ideas and opportunities coming to the region, healthy living can continue to strengthen the tapestry of rich, vibrant culture that can only be described as El Valle.